Hi there, I'm Dr. Matthew Schulman, board certified plastic surgeon, and this is another episode of Ask Dr. Schulman, where I answer your most common questions about plastic surgery. Today's question is, what happens if I get my period the day of surgery? Do we need to cancel? The answer is absolutely not. Just because you get your period around the time of surgery doesn't mean you're at any increased risk of having a complication, so there's no reason to cancel your surgery. It may mean that you have a little bit of an additional nuisance factor because you're gonna have to deal with having your period and recovering from the surgery, but there's absolutely no reason why your surgery needs to be canceled. Now that's assuming that you're young, healthy, and are starting out with a normal blood count. But if that wasn't true, you wouldn't be in my operating room to begin with. One thing that can happen if you're having your period around the time of surgery is you might get a little bit more bruised. This is because your body during your menstrual cycle is programmed to bleed easier. So that means during your surgery, you may bleed a little bit easier and you might get more bruised than you would have been if you weren't having your period. So these are just some things to keep in mind. Obviously, if you're having your period, you want to let your doctor know so your doctor's aware of what's going on with your health, but it doesn't mean your surgery needs to be canceled. Regarding your menstrual cycle, I always warn my patients when they're having surgery that the anesthesia and the anesthetic medicines that are given to you during surgery can certainly affect your hormone levels, which means your hormone levels may bounce around a little bit, and that may result in irregular periods. This means that if you're having your period around the time of surgery, after surgery, maybe it lasts a little bit longer than normal, or maybe it ends really quickly and then comes back a week later. These are kind of the weird things that can happen. Things like this can also happen for a month or two after the surgery. So it's not uncommon for my patients to say that their period's been a little bit irregular for a few months, and that's just because it takes some time for the body's hormone levels to regulate themselves and normalize and regulate your period so they're completely the way they were before surgery. So don't worry if after surgery for the first month or two your periods just seem a little different than they were before the surgery. This is a really common thing that is seen after anesthesia, and it's because your hormones can be a little bit out of whack. I hope that answers your question. So if you're having your period around the time of surgery, there's nothing to worry about. We do not have to cancel your surgery. If you like this video, make sure to like it. If you have any questions, put some comments down below, and don't forget to subscribe to my YouTube channel so you don't miss any of these new videos that we're adding. Thank you very much.